Hospice. The word hospice stems from the Latin word hospitium, meaning guest house. Hospice provides humane and compassionate care for the people in their last stages of incurable disease, and so that they may live their last days alert and pain-free as possible. LifePath Hospice and how it is organized in Hillsborough County. Florida is called the Certificate of Need state. In order to have a healthcare agency of any kind, you have to apply to the state. You must provide documentation that there is a need for that healthcare organization, whether it is a freestanding surgical center or a hospital. LifePath Hospice was the first ones organized in the mid-1980s in Hillsborough County. They got their Certificate of Need and have always kept the Certificate of Need because they have always shown that they meet the hospice needs for Hillsborough County. LifePath is the only hospice in Hillsborough County. The houses are designed to be a crisis center. This is not a place to come and die. This is a place to come and get your symptoms cared for. For example, a patient who still has 6 months to live may come to hospice because everything is out of control. For instance, his pain is intolerable, he or she is very sick and is unable to take care of their pain medication due to vomiting. So what hospice would do is place a patient on infusions, also known as IV drip. One is for his pain and the other is for his nausea. Once the symptoms are under control, then the next step is to convert his pain medications from infusions to a patch to oral tabs. Once the patient is able to keep things down and is off of the nausea medication, the patient can then return home. Most people want to die in their homes. The above patient that I just described is not ready to die yet. He is terminal and he will die in less than 6 months, but he is still a couple of months out. In the last week of his life, he may be bedbound, and his wife cannot take care of him. Then maybe he will return to hospice. The difference between hospice care and conventional medical care. Hospice care. The family is their unit of care. For example, a patient who has a week to live would enter into hospice, and hospice would make sure the patient's symptoms and pain were under control, and his wife, his parents, and her parents were cared for as well. The family is their unit of care, not just the patient. Conventional medical care. When in the hospital you are the patient and you are all that any medical person will focus on, and the family would come second. You may or may not ever see a medical person or may have to wait to see someone on medical rounds. It is not a priority, whereas in hospice it is a priority because the entire family is considered the unit of care. Physical signs of approaching death. Pain. Most people die without having any pain. Hospice will manage the patient's pain. If the patient is unable to express his pain, then they will look for nonverbal expressions of pain. It would be a facial grimacing or being restless, or sometimes it could be a rub or rapid breathing. It is their job to relieve the patient's pain. Activity, sleeping. Patient may be less active and sleep more often. This is normal. The importance is that you and the family are there for your beloved one. Skin temperature and color. When a person is approaching death, the body's ability to regulate temperature will change. Hands, feet, and legs may be cooler than the rest of the body. Modeling may begin with a phenomenon where the toes start to turn blue and the circulation is shutting down and the discoloration occurs. Elimination. Urine output may be less than normal and may become discolored. The patient may even lose their ability to control bowel and bladder functions, and the patient may have to be put in disposable briefs. Breathing. Breathing patterns may begin to change. For instance, the patient may have slow or shallow breathing, or it may become rapid. Morphine may be administered for rapid breathing because one of the things that happens at the end of life is that the body goes into a state of acidosis. And in that state, in order to compensate for it, another body response is to breathe fast to slow off carbon dioxide. It is very uncomfortable. The membranes become dry and it becomes more distressing. Therefore, hospice would administer morphine in a very low dose to slow down the respiration, not to make them stop breathing, but to slow down the respiration to make the patient more comfortable. Food and fluids. As a person approaches death, he or she may need little or no food or fluids. This is a normal process. You do not want to force them to eat or drink, as this may cause coughing, anxiety, choking, and pneumonia. Disorientation, agitation, restlessness, and confusion. As a person approaches death, they become restless and agitated or even confused. They may try to get out of bed, or they sleep all over the bed and become very restless. You may find the patient crosswise in the bed, upside down, etc. This is all normal. These conditions can be due to many causes. Everyone dies in their own way, and it is impossible to predict when a person is going to die. Not everyone has the same symptoms, and not everyone has any of them. There are people who die peaceful, and others who have a horrible death. Those who do not die well is enigmatic and do not know why. Example, a person who may die well. A person who dies well seems to get whatever it is tied up in a bow, and they kind of let it go. They die peacefully and pain-free. A person who does not die well. A person may come into hospice with only a week or so to live, and they stay restless, agitated, and it seems like they always have pain, no matter what pain medication is given to them. Can never get them comfortable. It is a mystery. The spirit is very strong. There are reasons why a person may not die peacefully. Some people are afraid to die, afraid of what is coming next, or they still have unfinished business. No one truly knows. Whatever the situation is, hospice is there for them and their families. Advantages of dying in hospice. Family members can feel assured that their loved one is well taken care of. Family members can leave the facility and walk out the door and know that when the door closes, it is all behind them. They can sleep in their own home or at the facility. The patient is allowed to have a dog in their room. Cats are not allowed. A lot of people have trouble living in their house when someone had died. Others find it comforting. Many have difficulty with it. Another advantage is if they die at hospice, then the family does not have to deal with it. Hospice will make the arrangements with the county medical examiner, which allows the hospice nurse to attend the death of the patient and call the funeral home. The hospice nurse will call the patient's physician and will assist the family in properly destroying the patient's medication. The nurse will also make the arrangements to have the hospice equipment picked up as soon as possible. A member of the hospice team will stay with you. If you would like to see a counselor or a chaplain, one will be called. A team is made up of the following: nurse, nurse assistant, chaplain, and social worker. This is important because this team that is in place is for the whole family. This can assist in many ways. Benefits of hospice. When a patient dies, their family lives are changed forever. Hospice care does not stop after the death of a patient. Hospice will follow the family in bereavement for 1 year and 1 month after the patient has died. Depending on the facility and the person of what they want to accept, hospice offers an array of services. Counseling, group therapy, summer camps for children that have had a loss. Within a few days to a few weeks after a person has died, the bereavement department will call the family of the deceased and offer them their services free of charge. These services are entirely optional. Some people want everything. They can have, and others turn it down and say, "No thanks, I'm good." Hospice does not push their services on anyone. Family members have the option of accepting or not whatever services they want.